In this video, you're going to be getting a behind-the-scenes look with one of our patients receiving our stem cell exosome injections and also an FUE, or a follicular unit extraction procedure. Now, everyone in the office was shocked with the results we were able to see in such a short same-day procedure. Now, keep in mind, this is within the doctor's operating room, so viewer discretion is advised, as some parts might be a little bit graphic to certain viewers.
So the patient we have today is Arthur. Arthur is probably the most typical patient we get. Very classic, front of the head, balding. This is a very common pattern of male baldness, especially early on. It can happen earlier than your 30s, but usually mid-30s is when it starts. The interesting thing about Arthur is that he really does just need that one area. So what we're able to do for him in an area that was already bald for quite some time is combine our trophic stem cell exosome factor along with FUE procedure. So a minimally invasive microsurgical procedure which requires no anesthesia really, and what you're getting is a same day in and out complete restoration of the entire front of the hairline. And so what's really cool is that Arthur has agreed to kind of let us videotape him through the entire procedure so we can see what the process is like from start to finish. It involves multiple physicians really assessing the case to determine the best course of action. And then we use a technician, an artist, who really has been doing this for 15, 20 years. And you really do need an artist to kind of really get the hairline exactly the way you want it. It's important that it looks natural. Having that team combined approach for both safety and also for aesthetics is huge. So there's really 3 steps in this process. The first step happens before the patient even arrives for their FUEs, where they get prepped with a stem cell exosome treatment in order to restore the blood supply to the head, which is what we believe it does based on the research we've seen. The next step is we anesthetize the entire area with lidocaine. That essentially numbs the entire donor site as well as the front, and enables us to use our machine, which utilizes a little bit of artificial intelligence along with a human technician to suck up a hair follicle from the back and then just put it right back into the front. The last stage, when we're putting follicles in the front, involves also applying a trophic factor stem cell exosome solution to the front of the scalp, which really allows us to create a better healing environment, which is optimal for allowing those follicles to grow and heal as quick as possible. Patient goes home the same day, and with this procedure, we're seeing patients get back to work really within a week, which is pretty interesting for what we're doing. I can't even count how many different hair restoration machines are out there, but there obviously is one in the new Neograft that stands above the rest, which is really the Rolls Royce, or some people even call it the Ferrari of hair restoration machines. And that's because it has such a user-friendly interface. It works well with a human technician physician and uses a bit of artificial intelligence along with really patented state-of-the-art techniques to just very gently suck the hair from the back of the scalp and to help replace it into the front, all in one machine. So all of us were incredibly pleased.
I was shocked.
For me, just having a better hairline and more full hair will make me feel more confident, I guess, in a sense, when I go out, dress up. Everything else is already, done to the nines. Why not get the last part of the puzzle? Yeah, perfect. Okay. Thank you so much. Yeah, no, they did a phenomenal job. Painless experience, smooth and quick. That was the best part. They were great.
Usually when you do these FUEs without stem cell exosomes, there's still
red,
a lot of red.
puffy,
Yeah.
swollen.
Yeah.
You were.
Yeah, and this is something that is just, you don't see after an FUE procedure where there's really almost no redness, especially with all the instrumentation. So really cool to have these trophic factors. Even the technician who's been doing this for a while came in today, worked with us and said, this is super cool. So really had a great time piloting it with Arthur. Super fun.
Thumbs up or something, Arthur.
Yeah, that's right.
I can't move my face. It's like frozen.
So hopefully you enjoyed the little behind the scenes look. If you want to see more videos like this, let us know down in the comment section below and we can try to get as many as possible. Also, you can click the first link down in the description below. It's going to bring you to another video and see if stem cell injections and the FUE process could be something that could be right for you. And last but not least, if you want to learn a little bit more about the stem cell exosomes in general, go ahead and click the video on screen for a full-on video.